കാസർഗോഡ് വിഷൻ്റെ എല്ലാ പ്രേക്ഷകർക്കും മെഡിട്രാക്കിൻ്റെ മറ്റൊരു എപ്പിസോഡിലേക്ക് സ്വാഗതം. മെഡിട്രാക്കിൽ ഇന്നത്തെ എപ്പിസോഡിൽ നാം ഡിസ്കസ് ചെയ്യാൻ പോകുന്ന വിഷയം തൈറോയിഡിനെ കുറിച്ചാണ്. സാധാരണ തൈറോയിഡ് റിലേറ്റഡ് ആയിട്ടുള്ള രോഗങ്ങൾ, അതിൻ്റെ കാരണങ്ങൾ, അതിൻ്റെ സിംറ്റംസ്, അതോടൊപ്പം തന്നെ അത് ഏത് രീതിയിലാണ് ഡയഗ്നോസ് ചെയ്യുന്നത്, അതിൻ്റെ ട്രീറ്റ്മെൻറ്റ് മെത്തേഡ്, ഈ വിഷയമൊക്കെയാണ് ഇന്ന് മെഡിട്രാക്ക് ചർച്ച ചെയ്യുന്നത്. ഈ വിഷയത്തെക്കുറിച്ച് കാസർഗോഡ് വിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിക്കുന്നത് മാംഗ്ലൂർ AJ ഹോസ്പിറ്റൽ ആൻഡ് റിസർച്ച് സെൻറ്ററിലെ എൻഡോക്രൈനോളജിസ്റ്റ് ഡോക്ടർ ശ്രീറാം സാറാണ്. സർ, വെൽക്കം. See doctor, today we are going to discussing about thyroid problems. Okay, thyroid. See, thyroid and what is thyroid?
As we all know, because currently thyroid, every people have some knowledge about thyroid.
Okay.
Thyroid is a small butterfly-shaped organ, endocrine organ. It is an endocrine gland in front of the neck. Okay. It is placed in front of the neck in a butterfly-shaped organ. It is a small organ, a small gland, which secretes thyroid hormone.
Okay.
It plays a major role in body's metabolic rate and other functions which it does.
Okay, sir. So when it gets problems, sir?
When do you get problem is there is nothing like we can predict that who will get the thyroid exactly.
Okay.
But based on symptoms we can see that this patient is having some problems with the thyroid.
Okay.
So commonest and one more thing is family history. Like if parents are having or if grandparents are having, then there is not that the children should develop, but there is more chances that they will develop thyroid related issues.
Okay.
And your most common thyroid diseases are your it is called hypothyroidism,
Yes.
hyperthyroidism, and thyroid related nodules. These are the three most common things.
Okay.
Hypothyroidism means your thyroid gland is hypo-functioning, that it is functioning less.
Okay.
Hyperthyroidism means it is functioning more.
Okay.
And thyroid nodules means it is a small, you can say a mass or a small nodule in the thyroid, which can be seen as one swelling or this thing.
Okay.
And you will have certain symptoms also, which I will be
symptoms. Okay, so that we are going to discuss.
Yes.
See, symptoms means every disease has certain symptoms.
Yes.
Here, what is the symptoms? Any early symptoms?
Yeah, in hypothyroidism, like hypothyroidism is it is functioning less, thyroid gland is functioning less.
Yes.
Sometimes it may go unnoticed.
Okay.
That is, they will not have very prominent symptoms. They will be having vague symptoms. That is easy fatigability, or generalized, or the patient has slowness of movements.
Okay.
Then constipation.
Okay.
Then menstrual irregularities.
Okay.
And sometimes it may be present in the form of they are unable to have child.
Okay.
All those things are usually the presenting complaints in hypothyroidism.
Okay.
And sometimes there will be thyroid swelling in hypothyroidism also.
Okay.
And it is usually autoimmune. Autoimmune means that is, we do a test called anti-TPO in that.
Okay.
And after routine thyroid function, that is TSH T4, that time we will come to know that this is autoimmune or not, and then we get the reports of it, and then we treat.
Okay.
Then we have something, weight gain is another symptom of hypothyroid.
So actually thyroid problem is affecting body like that, sir. Weight gaining and say losing fall of hair, so that one also is the reason for this thyroid problem.
Hair fall reasons there are multiple.
One of the reason.
One of the reason is thyroid.
Okay.
That is hypothyroidism.
Okay.
And that can be due to other reasons also, like your anemia, vitamin D deficiency. Those things are also seen.
Okay. Then what is the causes for this one, sir?
Of hypothyroidism.
Generally thyroid problems have certain causes. So sir is already differentiated into three categories. So what are the causes for that?
Causes of hypothyroidism is one is, as in currently in India, that iodized salt is coming.
Yes.
But in earlier days, iodine deficiency was the most common cause of hypothyroidism.
Okay.
Iodine is required for thyroid hormone synthesis. In the gland.
Okay.
So if the iodine content, when it was less earlier, thyroid hormone synthesis or production was reduced.
Yes.
And that was the cause for hypothyroidism earlier.
Okay. Okay.
And second cause is autoimmune, as I mentioned earlier,
Okay.
that is anti-TPO being positive.
Okay.
That is the another cause for hypothyroidism.
Thyroid.
And the third cause is like post-surgery. If the thyroid gland is removed,
Yes.
then that function is not happening at all.
Okay.
That is another cause for hypothyroidism. There are multiple more other reasons also, but these are the most common things.
Okay, okay, sir. How we are diagnosing thyroid, sir?
Okay. This is one very common question, and this everyone has to be knowing also.
Okay.
And the routine test which we do is TSH, that is thyroid stimulating hormone, and T4. These two
Okay.
are actually sufficient for us.
Okay.
But we can do a thyroid panel which contains TSH, T3, and T4. That also can be done.
Okay.
And this is usually sufficient even at the periphery centers also we can get it done. But in certain conditions, especially in pregnancy, that time this total T4 is not much useful.
Okay.
And one rare condition is there, that is thyroid T4 carrying protein itself is less.
Yes, sir.
That time also this T4, total T4 is not much useful.
Okay.
That time we have to do one test called free T4.
Okay.
That may not be available in every place.
Okay.
That time that we will see and decide, and we get patient to get that free T4 test from a different place.
Okay. See, okay. After diagnosed those who got thyroid problems,
Yes.
then what is the treatment?
Yeah, now for hypothyroidism, treatment is very simple, it is curable.
Okay.
In simple words, what I can say is,
Yes.
a vehicle cannot run without fuel.
Correct.
Similarly, thyroid gland is not functioning.
Okay.
So we have to give that function from outside.
Okay.
So we are supplementing the same thyroid hormone which is produced by the thyroid gland in the tablet form. And it is one small tablet which has to be taken only once a day,
Yes.
but it is usually lifelong.
Okay.
So dose may be varying,
Okay.
but with that one simple tablet you can maintain the thyroid very well,
Okay.
and you will not have any problems with related to hypothyroidism.
Okay, okay. Then see, sir, that after the treatment,
Yeah.
when we are taking medicine, certain treatment for medicine, when we are taking medicine, throughout life we are using medicine,
Yes.
some other diseases.
Yes.
Say, regarding thyroid, what is the position that one? How should we take, how long we should take the medicine throughout a lifetime?
Yeah, for hypothyroidism, that is less functioning, thyroid gland functioning less, for that it is lifelong treatment only, usually.
Okay.
And sometimes it will be borderline, that we call subclinical hypothyroidism.
Yes.
When TSH is less than 10,
Okay.
that time, sometime only during pregnancy and all we treat them, and after the delivery and all we stop them on tablets when it is borderline.
Okay.
But in a proper full-blown hypothyroidism, it is usually lifelong.
Okay.
And there is no side effects. You should not
Okay.
worry about that thing,
Okay.
because what tablet we are giving, it is the same hormone which is being produced by our body itself.
Okay.
That we are giving in the tablet form. That is the only thing.
Okay, those who got this problem, sir, they should eat this food or avoid this
Yeah.
food. Any criteria for that?
Actually, there is a lot of controversy in that. Whether, because even our research says that some people say that we should avoid this cabbage, cauliflower, and some people say that the effect of that on thyroid is not much.
Okay.
So what I would suggest is to be on safer side, you can avoid this leafy things, that is cabbage, spinach, cauliflower.
Okay.
You can avoid, but it's not like you should avoid.
Okay.
Yeah.
Okay, okay, sir. See, from OPD, from your experience, sir, see, when male and female, who got this problem more, and how it is, statistics
Yes.
showing what?
Usually the problems are more with the females. This problem,
Okay.
hypothyroidism, is more with females.
Females, sir. What about the children?
Children, yeah. Even this, when the mother is having thyroid
Yeah,
problem,
inherited
sometimes the child also can develop. One thing is that. Second thing is, even if the mother is not having, in the child, if the thyroid gland development itself has not occurred,
Okay.
then even thyroid problems can start at birth.
Okay.
And what are the symptoms in the child? So this also should be people should be aware. That is, if a child has jaundice at birth,
Okay.
or then we call umbilical hernia, that is near the umbilicus some mass is coming out, that umbilical hernia, or prolonged jaundice, that is staying for in NICU for long time.
Okay.
Poor cry, baby has not cried immediately after birth.
Yeah.
All those things are some of the signs that the child might be having thyroid related issues.
Okay.
And that also we should keep in mind. Thyroid hormone is very much necessary for neurological development, brain development of the child.
Okay.
So if we detect early, then that child will be normal.
Okay.
If we don't detect early and if we don't start treatment in those children, then they can develop mental retardation and poor school performance, all those things. So which can be, it is a preventable cause of mental retardation.
Okay.
So detection early is better.
Okay. So sometimes we have noticed that neck swelling is there.
Yes.
See, is it any related with thyroid or something?
Yeah, and next
Many
swelling-
cases, you see, we
Yes.
have seen that.
Yes.
Sometimes they are setting goiter, some other
Yes.
words they are using. So, what it is any relation with any connection with the thyroid problem?
Yes. When we say goiter,
Yeah.
goiter means that it is enlargement of the thyroid gland.
Thyroid glands.
But neck swelling can be due to other causes also. It is not only
We should
thyroid.
diagnose or we should find out what is
Yes, yes. So better to consult the doctor only to say whether that what is the nearby doctor than deciding this thing only, or you can come to us definitely. And because lymph nodes are present here,
Yes.
then thyroid gland is present.
Yeah.
Then we can say we are in the midline if it is present. Then
Okay.
there is something called thyroglossal cyst.
Okay.
That is slightly related to thyroid, but not this thing. So that is another thing. So there are 3 or 4 other reasons also.
Okay. Okay, so one more thing is that you see thyroid problems or this one swelling or goiter, is there any connection with the cancer?
Cancer, thyroid swelling.
Yeah.
Thyroid swelling per se is not cancerous.
Okay.
But if it is a nodule,
Yeah.
nodule means one-sided enlargement,
Okay.
or if it is hard to touch,
Okay.
then it is not like thyroid cancer is not possible. Thyroid
Okay.
cancers are possible.
Okay.
But one thing is, thyroid cancer is one of the best cancers to have because it is
Okay.
curable.
Okay.
And it is detected usually at earlier stages.
So we can easily cure.
Easily curable, not to worry at all. It is 100% curable. Thyroid cancers are usually,
Okay.
unless it has reached stage 4,
Yeah.
where it has
Before
spread.
that, we should find out
Yes,
our
yes.
diagnosis and curable this one.
Since this thyroid gland everybody sees, if patient also has not seen, the other person standing opposite
Yeah,
will say your
yeah.
neck is
Yeah,
something
correct.
enlarged.
Enlarged.
So they will definitely come to doctor. So usually these thyroid nodules are detected very early.
Okay.
So usually it's not a problem.
Okay. So today's topic is thyroid and thyroid problems.
Yes.
And we have already discussed about what is thyroid, where it is located, their glands is already explained that where is it located, what are the contributions of thyroid glands, and what is the problems of thyroid, and how to diagnose it. Treatment is there. Any message to viewers?
Just to add on before concluding,
yeah.
this is most of the things which I have spoken is about hypothyroidism.
Yes.
There is something called hyperthyroidism also.
Yes.
That is hyper functioning, more functioning. Thyroid
Yes.
gland is functioning more.
Yes, sir.
That is if they will have weight loss, you will have diarrhea,
Yeah.
you will have palpitation. That is heart is beating more.
Yeah.
All those things.
Okay.
That is one disease which is curable. You will not require medications for lifelong.
Okay.
You will require for 1.5 years if you are taking tablet, or if we have something called radioiodine ablation, where we ask them to drink one medicine, and with that the thyroid, that hyper functioning thyroid will normalize.
Normalize it.
So this is another curable thing. So
Okay.
most of the thyroid things are curable, and or you can maintain it with it.
Okay.
So it's one good thing. So thyroid, one thing, the end message what I could like to say is, thyroid is a simple endocrine gland, and the problems related to the thyroid are most of the time curable,
Okay.
and with simple cheap medications. It is not costly also.
Okay.
So any symptoms or anything, consult your doctor immediately. Don't hesitate about side effects. Don't
Okay.
worry about side effects.
Okay.
It is definitely a small
Curable.
disease, and it's a curable.
Curable also.
Yes.
Okay. Shall we wind up the program, sir?
Yes. Yes.
ഓക്കെ മെഡിട്രാക്കിൻ്റെ ഈ എപ്പിസോഡ് ഇവിടെ വൈൻഡപ്പ് ചെയ്യുകയാണ്. തൈറോയിഡ് ഉണ്ടാക്കുന്ന പ്രശ്നങ്ങൾ ശരീരത്തിൽ, അതെങ്ങനെ നമുക്ക് തൈറോയിഡ് പ്രോബ്ലംസ് എങ്ങനെ ഡയഗ്നോസ് ചെയ്യാം, അതിൻ്റെ ട്രീറ്റ്മെൻറ്റ് രീതി, ഇതൊക്കെയാണ് ഇന്ന് കാസർഗോഡിൻ്റെ പ്രേക്ഷകരോട് മാംഗ്ലൂർ AJ ഹോസ്പിറ്റൽ ആൻഡ് റിസർച്ച് സെൻറ്ററിലെ എൻഡോക്രൈനോളജിസ്റ്റ് ഡോക്ടർ ശ്രീറാം സാർ പ്രേക്ഷകരോട് വിവരിച്ചത്. എല്ലാ പ്രേക്ഷകർക്കും നന്ദി, നമസ്കാരം. താങ്ക് യു സർ.